This is Westerville's patient too. We're gonna steal you. It's okay. I know, there's so much happening. Hello. It's okay. Here you go. Where are you going? It's okay, little one. Hi. Good job, sweetheart. You're okay. I know, you got pulled away, silly girl. She says no.
There's a cat.
You gotta walk, sweetheart. You're okay. Girl. Michelle, can we try tail walking her? There you go. Just run right to the door, little one. All right. There's no movement, so we'll pinch your toes. 1, 2, 3. Okay, good job. That was very good feeling. 1, 2, 3. Good girl. 1, 2, 3. Okay, hi. Good girl. You didn't even withdraw them. Hi. So Maddie's a 9-year-old female spayed dachshund mix. She presented yesterday after falling off the couch, after which she could not walk, unfortunately. On her initial exam, she had a little bit of movement in her left hind limb, but no movement in her right hind limb. She could still feel it though, which was good. The owners did elect to move forward with MRI and surgery, so last night she underwent a T12-13 hemilaminectomy on the left side. This morning, she's lost movement in both legs, but can still feel them. Quite honestly, it's not surprising. After surgery, we create some inflammation as we're healing, and then also it can take up to 24 hours to see the full extent of the initial injury. We're still very much within that window for Miss Maddie. So while we do look technically a little bit worse this morning, my expectation and my hope for her is still that she'll do well. She's still. I'm over here bouncing your curls and you had zero idea. I mean, the fact that I'm being recorded today is just going to make me even more like ridiculous. Miss Lilo is a boxer mix that presented to us about a month ago for some limping in her back legs, yelping in discomfort, and hesitancy to get up. Following evaluation, the owners did return the next day for a drop-off MRI, which revealed changes to her LS or lumbosacral space. Although her exam was more right-sided with her discomfort, her MRI was more left-sided, which made for some interesting findings, and so we submitted her MRI to a radiologist for a secondary opinion as well. While we both agreed on the description of the lesions, there was a little bit of talk about whether this was discospondylitis or cancer, and so discussed those concerns with the owner today. Ultimately, Miss Lilo on her recheck today has been doing better at home. Still a little bit slow to stand up and lay back down, but overall, no more crying out. Her energy level and her want to play with toys has come back. So given the fact that she's responded well to antibiotics thus far, we are most supportive of something like an infection going on in that LS disc space. After discussing with the owners, they would like to continue to focus her treatment on something like discospondylitis and continue to monitor her for improvements. As such, we'll be continuing her on her antibiotics and then pain meds as needed. It's still pretty early on in her treatment course, so I'm not surprised she has some residual discomfort, but obviously I want her to feel better, so we're going to make sure and recheck her a little bit sooner than we might otherwise, make sure that discomfort is resolving before we continue on forward with the treatment for her discus spondylitis, which can take up to a year if not longer. Sometimes I'll be sitting at my desk just like beat bopping and doing records, and Rock will be like, "Are you listening to something?" And I'm like, "Yeah, the beat inside my head." Hi. You're very strong.
We're gonna get down.
Are you wagging your tail? Are you wagging your nose? Louis is a 4-year-old male neutered French Bulldog that presented today for a 5-week recheck of conservative management of non-ambulatory paraparesis. When we initially saw him, he was too weak to walk on his own. The owners did elect to pursue conservative management at that time for a suspected disc herniation. At home over the past 5 weeks, he's continued to improve, even as his medications have been slowly stopped. On examination today, he is strongly ambulatory, able to walk on his own, but he has quite a bit of increased tone in those back legs, which as a result has reduced some of his reflexes. Additionally, he has increased spatial awareness of those back legs as well, and he's much more comfortable on palpation of his back. So we're very happy with his response thus far to conservative management. The plan for him is to continue forward, so we'll be giving him a little bit more space, but still keeping him on some degree of activity restriction, continuing him on his anti-anxiety medication so that he's able to tolerate that rest as he continues to recover. And then we're going to add in a medication to help facilitate proper urination. With that increased tone that I mentioned, he's having some trouble fully emptying his bladder, and we don't want to increase his risk of things like urinary tract infection, so we'll give him some medications to support that. The other big factor I spoke with the owner about to help facilitate his recovery is considering formal physical therapy for him to help continue to break down that tone and get him back to a more normal gait and overall good quality of life, but my expectation is he should do well.
For one second I thought it was like pizzas from little pizza boxes.
I wish I'd go for some pizza right now, just because I'm really hungry for lunch. Maybe I'll eat lunch after this and see what else gets scheduled. Pat, did you catch it? I didn't realize you were doing that. That is the best way to catch my weird faces. You want us to high five? You have to come back and high five me. Do it with a smile. Turkey!
That was.
And then I just stand here and wait for it.
It's too hot. She's gonna burn herself.
That was funny. Okay, we
right,
wait. We wait.
All right, Miss Bella is a historic MUE patient of ours. We see her on a regular basis for Cytosar treatment. She does look overall a little bit better, starting to continue to regain some strength in her back legs, which is great news. Currently being managed on prednisone, atopica, and Cytosar treatments. So today we went ahead and gave her next dose of Cytosar. Given the fact that we just reduced her prednisone recently, we'll be continuing her current dose of prednisone with plans at her next visit, if she's still doing well, to go ahead and reduce that prednisone further in an effort to get her to her lowest effective dose, since prednisone is what's most likely to be causing side effects for her. Her atopical will continue that long term at its current dose. Today there were some concerns brought up about some bumps on her skin that seemed to be bothering her perhaps. Unfortunately, they don't appear to be related to the prednisone. I'm more suspicious of something like environmental allergies, so I do recommend that she follow up with her primary care veterinarian for management of that, and then we'll see her back in 4 weeks for her next dose of Cytosar. Mia is an 11-year-old female spayed Shih Tzu. A few days ago, she began yelping with a hesitancy to walk and not wanting to eat. She went to her primary care veterinarian, who was concerned for a neck problem, and started her on a few medications. Unfortunately, she's continued to be painful despite those medications, and as such presented to us today. On examination, the good news is she had no neurologic deficits, but she unfortunately did have marked cervical pain on gentle palpation. We spoke with the owners about a concern for something affecting the spinal cord in her neck, such as an intervertebral disc herniation, less likely to be a compressive tumor, or autoimmune inflammation given her age. We talked about options for doing MRI and surgery, or trying to medically manage her. At this time, they've elected to move forward with conservative management, so we started her on anti-inflammatory medication, an antacid to help protect her stomach, a muscle relaxer, multimodal pain control, and then also an anti-anxiety medication to help her tolerate strict kennel rest for the next 4 weeks. Ultimately, resting in the kennel is what is the most important part of her treatment plan as her body recovers. We'll plan to see her back in 3 to 4 weeks to make sure her pain is improving before we start to give her more space and more activity.